Malaria is one of the most important public health issues worldwide. In fact, it is the leading cause of mortality in many developing countries, including Nigeria. Many young children and pregnant women are mostly affected by malaria, which caused about 409,000 deaths in 2019 alone, according to the World Health Organization.
It affects our economy, affects lives, and then it causes paralysis to some of the health challenges and then the productivity of individuals, especially children and pregnant women, as I've mentioned.
Malaria slows down economic growth and development, perpetuating the vicious cycle of poverty. For instance, in Nigeria, malaria accounts for over 40% of the total monthly healthcare costs incurred by households when compared to a combination of other illnesses. Overall, malaria imposes substantial costs to both individuals and governments, and it is bad for society. Malaria is bad for businesses.
We all know mosquitoes don't stop flying and don't stop infecting others just because of the current pandemic. The risk remains and are amplified by challenges in delivering critical diagnosis, testing, and treatment programs and services.
At the onset of the pandemic, we were concerned that severe disruptions to malaria programs, specifically to bednet campaigns and access to anti-malaria medicines due to COVID-19, could lead to a doubling of deaths from malaria. Lockdowns, potential challenges to manufacturing, social distancing and economic hardships all conspire against the regular dissemination of these life-saving nets.
Remember too, at a point, even health workers were, because of lack of protective equipment, were not attending to malaria patients generally.
It is essential that amidst this pandemic, we continue protecting and saving vulnerable groups, such as pregnant women and children, with very, very essential intervention. The private sector is a critical stakeholder in achieving the Sustainable Development Goals. Goal 17 is focused on partnerships and encourages stakeholder collaboration with an end aim to achieving the goals. Additionally, as private sector organizations, we cannot deliver on economic progress without a healthy people. The influence, resources, and skills that Africa's thriving private sector can apply to drive positive change is immense. If we all work together to influence policy, advocate strong political will, and increase funding, we can undoubtedly influence a considerable shift in malaria cases and deaths.
Private sector has that tremendous role to play, either in their workplace or in the communities where their industries are sited.
So the private sector plays a significant role in terms of innovation and scale by delivering and innovating tools that are critical to the fight. Putting chemistry on a bednet is a challenge. Screening active ingredients that are safe to humans but lethal to mosquitoes and mass produce and distribute them safely is indeed a challenge we are very keen to take on. The private sector has to innovate faster than the mosquito can mutate and scale up new solutions rapidly. We need to bring tools to market earlier than ever. We are working diligently on the next generation LLINs to stay one step ahead of insecticide resistance. But if we want to bring innovation to market, we need strategic partnerships.
The End Malaria Project is an initiative to galvanize the private sector resources and capabilities towards ending malaria in Africa, starting from Nigeria.
This End Malaria Plan and Project is a significant piece of achieving all of our prevention goals and will lead to saving lives, which is really what matters the most. Addressing health threats like malaria is not just one organization's or one government's responsibility. We all have a role in community health and prosperity. In closing, I encourage us all to stay engaged, incorporate lessons learned from the past, Get others involved, focus on outcomes and impact, and contribute in a way that is meaningful for you.